I'd like to welcome Dr. Doug Woods to the program. Dr. Doug Woods is a clinical psychologist and internationally recognized expert in Tourette Syndrome and tic disorders, based in the Chicago area. He's best known for one of the lead developers of comprehensive behavioral intervention for tics, CBIT, the gold standard evidence-based behavioral therapy now recommended as a first-line treatment for Tourette syndrome. Dr. Woods has spent decades advancing both clinical care and research for individuals with Tourette syndrome, OCD, and related conditions. He has authored hundreds of peer-reviewed articles, clinical trials, and treatment manuals, and his work has helped shape international treatment guidelines for tic disorders. In addition to his work, Dr. Woods is a sought-after educator and speaker, training clinicians around the world in CBIT and behavioral therapies. He has also served in leadership roles within major professional organizations and remains deeply committed to reducing stigma and improved access to effective, compassionate care for people living with Tourette syndrome and their families. I'd like to thank you for being on this program with us today, Dr. Woods. To start, I gave a little bit of an introduction about yourself, but maybe if you wouldn't mind describing some of your focus with Tourette syndrome research and treatment.
Sure. So yeah, for the last, over 30 years, I guess. It's hard to think that way, but I've been working on developing and testing and disseminating non-pharmacological treatments for tic disorders, including really the whole spectrum from understanding from a behavioral standpoint what influences tics and how people with tics are influenced by them, to developing the non-drug treatment we call CBIT, to then testing it, making sure that it works, and then really on the other end to figuring out ways to best make the treatment available to people throughout the world. So that's really been the kind of the arc of my research career is, like I said, from understanding to treating to disseminating the treatment for individuals with the disorder.
Great. Continuing with CBIT itself, obviously you're very known for your work with CBIT. How would you explain CBIT in terms, simple terms, to a family hearing about it for the first time?
Sure. So CBIT is a behavioral treatment for a neurological condition, which sometimes confuses people. But when I say, look, if you have a stroke, one of the best ways you can recover from a stroke is to do what we call rehabilitation or rehab, which is a behavior therapy that helps the brain retrain itself to overcome the initial problem. And we look at CBIT much the same way. We know tics are caused by problems in the brain. The basal ganglia is probably the area where people look most, but we also know that the brain can work around some of the problems in the basal ganglia that lead to tics. So what CBIT does is help to harness the brain's capacity to heal itself, if you will, or to work around its problems in two ways. One is we know that tics are heavily influenced by the environment, by the context they're in. So one of the things we do is really try to identify the triggers in the environment for a person's tics and help them learn how to change their environment so that the tics are less likely to happen. The second way we do it is we teach them to notice when they're about to tic. Many people with tics have this, what we call a premonitory urge. And as soon as they notice that urge, we give them an exercise to do that blocks the tic. And we ask them to hold that exercise until that urge goes away. When they do that with repeated practice, the brain learns that it doesn't need to do the tic every time it has that urge, and then tics tend to subside. And so with repeated practice, we can usually make some pretty strong gains using those two techniques in what we call CBIT, or the comprehensive behavioral intervention for tics.
And regarding the effectiveness of CBIT, is there a difference between children and adults and how effective it may be in treating Tourette's?
Yeah, we know it works for both age groups, but you probably get a little bit better effect when you're younger. So children, when you're a child and you get CBIT, your response rate is a little bit more robust than when you're an adult. So the message from that would be, it's better to treat when you're a child than to wait to be an adult with full-blown Tourette's. The treatment will work, but it just won't be as effective.
Okay. And when families ask you, will this stop tics completely? How would you help set realistic and reassuring expectations?
I would say that's not the intention of the treatment. This isn't a cure for tic disorders. It's a management strategy, just like medications are a management strategy. Now, That said, do tics go away in some cases? Yes. Certain tics that are particularly problematic sometimes go away. That doesn't mean that all tics are gone. That doesn't mean tics will never come back. But we do know that if you go through CBIT and it works for you after about 10 weeks of treatment and you get significantly better, we know there's a good chance that you'll stay significantly better up to 10, 11 years later. There'll be periods of fluctuation. It gets better, it gets worse. But overall, you'll be in better shape for having gone through CBIT if it works for you during the initial course of it.
Great. Are there common myths or misunderstandings about behavioral therapy for tics that you'd like to clarify?
Sure. There are a few that are out there. One is that it has some kind of behavioral side effects, that it makes you more anxious or depressed or stressed out, and the evidence doesn't really show that. Another myth is that it doesn't last very long. We actually just published a paper that as it just referenced, which shows that if you get better from CBIT, you're actually 11 years later still significantly better than if you hadn't gone through CBIT. So it tells us that the gains that you get are often durable. Another belief that's out there is that if you hold back your tics at CBIT, that it will cause an explosion of tics later on after you stop using the treatment. The evidence really doesn't suggest that. It suggests there is really no rebound effect, and that's been tested in multiple studies. And another kind of myth that is out there is that, in CBIT, we address one tic at a time. We teach you to control one tic at a time. And sometimes people believe that that will cause new tics to start. Of course, new tics start because that's what happens in Tourette's. Kids with Tourette's always get new tics that reappear. But doing CBIT doesn't make it any more likely that a new tic will start. So it's not like you're replacing one tic with another tic. And so those are some pretty common myths that are out there that just really the evidence doesn't support.
Well, that's reassuring because I know that has come up in discussion with other people before. Access to CBIT can be challenging for some families. What progress have you seen and what still needs to improve with regards to access?
So we've done a few things in our work. One of the things we tested was whether or not CBIT can be effectively done on Zoom or telehealth kind of modalities, and our data are pretty reassuring. We're pretty sure that you can do it over Zoom effectively and over telehealth effectively, so we're confident in that. We still have some cost and access issues. Not everyone can afford specialized therapy. Not everyone's in a region where they can get specialized therapy, even with the rise of telehealth. So there are programs out there. I was part of a group that started one called TicHelper.com, but there are other ones out there too that are online self-help versions of CBIT. And so that's something that's been done to try to counter that. The other issue is really training of the availability of trained therapists who really know what they're doing. One of the things we've done, I've been a part of a group that has worked to develop what we call CBIT Trainer, which is a website for therapists who want to learn how to do CBIT. You can get on and it walks you through a 12-hour training protocol for learning how to do the treatment. And so hopefully those kinds of things can make treatment more accessible. One of the things that we need to do more of is just more training of therapists. And the Tourette Association of America has done a lot of behavior therapy institutes where they try to train therapists in CBIT. I know that there have been Canadian groups that have done that as well. And so that's great that that's happening. The Tourette Association of America runs a referral list that they maintain of people that they know have been trained in CBIT. So that's another place to go look to see if you have trained therapists, at least in the States. I think they might have some Canadian psychologists on there too, but I'm not 100% sure.
Okay, so that would be your best resource then as a parent looking for?
At this point, yeah.
Okay. Lastly, what message would you like to give parents or individuals newly diagnosed with Tourette's? What would you like them to hear today regarding CBIT?
A couple things. First of all, CBIT's a lot of work, but it pays off. If you can put the work, it's not going to be for everybody, but for those who it works for, it's a very effective tool that the kids can learn. But it involves the whole family. It's not just the child's job to go through CBIT. But I would also say if you're a newly diagnosed parent with a newly diagnosed child, you're probably at a point where you're a little nervous and scared and thinking about what's coming. and just know that there's a lot of resource out there for you. Make sure you contact your local support organizations, contact the Tourette associations, talk about it with your kid. Your kid knows he's doing something, right? He doesn't know what it is yet. He may not understand it. So just make sure you talk with him about it. And I say him because it's, mostly boys compared relative to girls. But make sure you talk with your children about this if they have diagnosis. Encourage them to explain to other people what they're doing. One of the things we've learned from some of our early research is that when people around your child don't know why they're doing the things they're doing, the stuff they come up with to explain it is much worse than what the tics themselves are. And so make sure your child feels comfortable talking about their condition and knows how to explain it to people. And that in and of itself can be empowering. I think one of the things we forget about as we're parents, and we if you don't have tics, you don't understand this, is one of the things Tourette's really is a loss of control in a way that most of us could never understand. Most of us, we go through our life, if we want our body to do something, it does it. If we don't want our body to do something, it doesn't. A person with Tourette's doesn't have that fundamental sense of control. Their body just does things, right? And so we have to make sure to understand that part of the Tourette treatment is giving your child that sense of control over themselves back. And I think that's one of the things CBIT does very well, is actually teaches the child that this is your body, you get to control it a little bit more than that condition has allowed you to do so far. So I think that's an important message to send.
Perfect. I'd like to thank you, Dr. Woods, for your time and expert opinion. I know this will be thoroughly enlightening for our audience and give them some potential resources and hope for themselves and other individuals with Tourette syndrome. So I'd like to thank you very much today for your expertise.
Right, thank you, and thank you for the foundation of the work that you're doing. Appreciate it.
Thank you.